Good morning, everybody. I'm Catherine D'Amato, the President and CEO of the Greater Boston Food Bank, and I'm so glad you could join us this morning as we present to you the results of our second annual statewide food insecurity study called Opportunities to Improve Food Equity and Access in Massachusetts. I'm going to thank you for just spending some time with us to learn about these findings and this important research and some proposed recommendations that have come out of this study. And I also want you to know this is being recorded and it will be made available to you upon request. And if you've signed up for this, you're going to receive it. But if there are others that you think should see it, please feel free to pass it along. I do want to thank a couple of our funders that made this possible, the Hunger to Health Collaboratory and our founder of the Collaboratory, Stop and Shop, for providing the financial support. Over the last 2 years, we've all seen pretty dramatic and unprecedented levels of food insecurity, families struggling to recover, budgets being pinched, and first year, a lot of complexity and confusion and uncertainty, volatility, enormous consequences that have come out of COVID. And in this second year that we're living with COVID, the impact of inflation. And this is enormously important in terms of how people are making choices with their food budget in order to pay something else. So lots of balancing, lots of hardship that's going on. So let me just tell you a story about Sharon, who happens to be the director of our island food pantry on Martha's Vineyard. She lost her job as a chef at a big restaurant on the island during the pandemic, and she turned to her local food pantry for help to feed her children. The food pantry eventually has had an open position. Here's the good news. Sharon's now the director of that island food pantry, helping to provide food for about 700 people every week. A terrific story. And she was fortunate to get that job, that she could find passion in feeding people in a moment in her life that she deemed extremely difficult. People have had enormous sadness, enormous loss during this last 30 months now that we've been living with COVID. So the Greater Boston Food Bank, as well as our partners at the Worcester Community Food Bank and Western Mass Food Bank, worked with over 1,000 distribution partners, pantries, meal programs, and shelters across the state in order to provide food for those who are seeking it. And in addition to our network, there are people seeking assistance from a variety of other points of access. Many of these, school programs, both breakfast and lunch, maybe their healthcare provider, or being referred to SNAP or WIC, or they might have an opportunity at their community center or library, their church, synagogue, or temple to find food. But still, even with all of this, we know that we can do better. We know that there are both policies and program choices and decisions we can make to ensure that there's greater access, and especially with undue barriers in many disproportionately served communities. You're going to hear a lot about this today. It's critical that we listen to the communities we serve and to ensure that we're meeting their needs. Each community is different. In Eastern Mass, we have 190 different agencies, and as I said, across the state, there are nearly 1,000 programs that are providing food. Each is uniquely different, but we will need help with Congress, at our state house, in our municipalities, and we want to make a lasting difference for almost now 1.8 million people in our Commonwealth struggling with hunger. So we have many indicators and many ideas to be sharing with you today. And I do want to get to the study so that you can be able to learn about what we've learned and to help us as we work through wanting to feed as many people as possible the best, healthiest food, and to be able to, in these incredibly unprecedented times where these numbers that you're going to hear are unprecedented. I've never seen this number before in over 40 years of my work in food banking. So just sit back, listen, hold your questions, and we hope to be able to bring this data along with a lot of other data to the White House conference that's going to take place in September, the first White House conference on hunger, nutrition, and health in 50 years. So this is a timely study, and I want to thank the entire team that put this forward, and you'll hear more about that and from each of them in a moment. But before we begin our presentation, I'd like to share a special message from our friend and fierce national advocate serving the 5th District of Massachusetts, Assistant Speaker, U.S. Congresswoman Katherine Clark.
Hi, I'm Congresswoman Katherine Clark, and I want to thank the Greater Boston Food Bank for their 2nd annual report and survey. The results are staggering. 1/3 of those who live in the Commonwealth of Massachusetts suffer from food insecurity. And those rates, if you're in a community of color, an LGBTQ person, or a family with children, are even higher. Thank you for bringing a focus on this issue of hunger in our communities, and I look forward to working with you in Congress to make real solutions for families at home.
And now you're going to hear from our experts and from the team who's responsible for this incredible work. And please welcome now Director of Business and Data Analytics, Daniel Tattlebaum.
Thanks, Catherine. Good morning, everyone. The Greater Boston Food Bank's Business and Data Analytics team provides actionable insights to inform GBFB's operations and strategy and build awareness and engagement to hunger relief partners and community members across the Commonwealth to ensure equitable access to healthy food for all those in need. This study is a key piece of our work, advancing the understanding of food insecurity prevalence and the unique experiences and access barriers of Massachusetts residents struggling with food insecurity. Last year was the first year we conducted a statewide survey and collaborated with the National Food Access and COVID Research Team, or NFACT, a national collaboration of researchers committed to rigorous, comparative, and timely food access research during the pandemic. Recognizing the importance of this study, we decided to build on this work and conduct a second survey this year, evolving last year's survey to further explore the inequities and other issues related to food insecurity and food assistance use. To inform our research, we worked with experts from GBFB's Health and Research Council and many other community and hunger relief partners, including the Food Bank of Western Massachusetts, the Worcester County Food Bank, the Merrimack Valley Food Bank, Project Bread, and the Department of Transitional Assistance, to name a few. Guiding this year's research was our Senior Health and Research Advisor, Dr. Lauren Fickner, a pediatrician and Director of Nutrition at Mass General Hospital for Children. I will now pass it to Dr. Fickner to present our findings.
Thanks so much for joining us today. It's really exciting to see so many people passionate about this data, and we really hope that this can be useful in all the work that you do. You can go to the next slide. So from December 2021 to February 2022, we used an online survey company and surveyed more than 3,000 Massachusetts adults. And just to be clear, these are all adults across the state, not just in Eastern Massachusetts. Also, I'll just mention that these adults were potentially using food pantries or potentially not. So it's pretty unique in that we can do that. The survey oversampled adults with lower incomes, so we could ensure we heard from the people most likely in need of food assistance. And we used weighting methods to collect estimates that are representative of the Massachusetts adult population. So our goals were first to identify changes in the rates of food insecurity and food assistance use from last year. We also really wanted to document barriers and facilitators of food pantry use and SNAP enrollment. This is really important to us so that we can get more people services that they need. And then finally, to develop data-driven recommendations to improve food access equity through programmatic policy and advocacy efforts. And we hope that you also can use this data in your work. You can go to the next slide. So what's new in this report? Data on participants' gender and sexual orientation was added to this year's survey. We also expanded data on the experience of food pantry users and SNAP participants, including perceived experiences of discrimination. And we also have data on drivers of food pantry use and why people stopped using food pantries. You can go to the next slide. So our key findings are You can go to the next slide. Okay. So we found that rates of food insecurity among Massachusetts adults was persistently high during this time period as compared to pre-COVID levels. So you can see in the gray throughout this presentation, that's 2019, our pre-pandemic year, and then 2020 is the first year of the pandemic, and then 2021. So overall, food insecurity based on our estimates have risen from 19% pre-pandemic to 32%. And in order to estimate this, we use the 6-item USDA Household Food Security Survey module. And just to define food insecurity based on the USDA definition, it really means consistent access to healthy food for an active and healthy lifestyle. And so you can see that disparities persisted in 2021 with people who identify as Black having a 53% rate of food insecurity and our Latinx participants at 61%. As I said, this is our first year we have LGBTQ plus data, and we saw that 51% of those who are identified as LGBTQ plus on this survey identified as having food insecurity. Households with children also had a persistently high rate of 40% this year. You can go to the next slide. So in Massachusetts, one indicator of increased need has been pantry usage, and I hear this from our chief operational officer all the time. We are still in the surge, very much so, and our food pantries getting all this food out. And so she really wanted to know, how long is this going to last? And we really haven't seen any decrease in these levels, and possibly an increase as well with the concurrent expiration of benefits and the rise in inflation. You can go to the next slide. So this slide demonstrates our food pantry use estimates among Massachusetts adults with food insecurity. Again, the red bar is this year's results, which show that we have had a nice increase in people using food pantries, up to 46%. Last year we saw 32%. So essentially 1 in 3 were using food pantries in 2020 with food insecurity, and now that's up to 1 in 2 in 2021. You can go to the next slide. Food security inequities are really symptoms of much larger systemic barriers, including structural racism across many sectors. And I'll show you the next slide that shows adults with food insecurity had a much higher rate of perceived everyday discrimination at 86% compared to those without food insecurity at 50%. And we hope that this data can start as a catalyst to really helping us with the challenging road ahead of improving these inequities. Go to the next slide. So here you can see the perceived everyday discrimination by food security status. And so what participants were asked were if multiple different discriminatory events, if they've ever experienced it in the past year. So they were asked even up to just a few times per year. And if that was the case, then we said that they had experienced discrimination in the past year. So 86% of those with food insecurity expressed at some point in the last year they had experienced at least a few times a discriminatory event. As opposed to those food secure adults at 50%. They then are asked why they think that they experienced these discriminatory events, and the top reasons people cited, and they can cite more than one, includes gender, race, age, which uniquely is actually younger age, weight, and mental health status. You can go to the next slide. So we also wanted to know what's the drivers of food pantry use, and I will say that this was definitely a question that was created with all of the food banks and Project Bread, and to hypothesizing why someone might start using a food pantry and why someone might stop. And so increased cost of groceries was a big driver for people using food pantries in 2021. There was also decreased income at 42%. This quarantine due to COVID at 28%. This could be due to a family member being quarantined and them being unable to obtain food and potentially getting delivery from a food pantry, or it could be loss of income because of a family member with COVID or themselves. We also saw that some people did stop using food pantries, and we asked why that was, and 35% said it was because of increased federal food assistance that they were able to stop using food pantries. Also, 25% indicated that their household income increased. And we hear this a lot, that people get help from families or friends, and we saw that in the quotes as well, and that was at 23%. There were still some that couldn't get there when it was open at 21%, and also felt that it was too hard to get to. You can go to the next slide. So this part-time worker in Marshfield, who was a participant on the survey, said, "I'm grateful to the food pantry. I've been receiving more SNAP, so I haven't gone to food pantries as often as I used to. As grateful as I am, it's embarrassing, not because of the staff, they are wonderful, but because I can't always get nutritious food from supermarkets because of expense." So it sort of summarized the increase in federal SNAP benefits that we saw, but also this rising cost of groceries driving folks to food pantries. You can go to the next slide. So we wanted to know, how can we improve our services at food pantries? And we asked food pantry users what would drive them to come more often to the food pantry. And 54% said they would come more often because if they were offered grocery cards. 49% would use the services more often if they got home delivery. 32% wished for online ordering. 30% wanted curbside pickup, and 23% wanted recipes for the provided food. And go to the next slide. So this single mother in Attleboro says, "My vehicle died recently and I have 4 little kids, so I get rides to the food pantry when I'm able to find a ride and a babysitter, but it isn't easy, especially in a pandemic, so I do wish they had an option to help in situations like this. I'm extra behind on bills because I've had to use bill money for food." So you can see how this family could be really helped out by delivery from a food pantry. You can go to the next slide. And here you can see SNAP enrollment, and we'll get into participant experiences in the next slide. But what's really encouraging from our standpoint is that you can see in the gray, in 2019, SNAP use was at 25% pre-pandemic among adults with food insecurity in Massachusetts. And we saw a really nice increase to 55% utilizing SNAP in the past year, which is wonderful to see. There were increases in all demographics in SNAP use. And then, as I mentioned, this is our first year of having LGBTQ+ data, but 60% of those adults who identified as LGBTQ+ and had food insecurity were enrolled in SNAP. Households with children, also we saw a really nice increase to 64%, which is great to see as well, up from 27% pre-pandemic. You can go to the next slide. So these are reasons reported by adults experiencing food insecurity for not using SNAP in 2021. And we again saw this, as we did last year, is 75% really want to support themselves instead of using SNAP. We also saw that 64% were worried that getting SNAP benefits would take them away from someone else who needs it more. I saw that in the quotes as well. People were really worried if they went to a food pantry, they were taking food from another family. So I think getting the word out about that they're not taking benefits from others, is a really important lesson from the survey. There's also a knowledge gap. So those adults with food insecurity not using SNAP, they were not sure if they were eligible for SNAP or not. 46% were worried about the information they needed to share to enroll in SNAP as well. We can go to the next slide. So this was a great question from one of our SNAP associates, Krista, and she really wanted to know how the increase in SNAP affected people in our state. And so for 71% of SNAP users, they said that the SNAP increase during COVID freed up money to pay other bills, but 84% were really worried about being able to afford enough food if the SNAP increases were to stop. And we saw this in the quotes over and over about this really extreme worry about this increased benefit ending. We can go to the next slide. So here is a SNAP participant from Boston who says, I'm so very grateful for my increased SNAP benefits during COVID, since it means I can afford to buy higher quality food on a much more frequent basis. We can go to the next slide as well. We also saw increases in uptake of the child nutrition programs across the state as well. So this estimates the adults with food insecurity with children under 5 and the WIC column. And so you can see that that's nicely increased from 33% pre-pandemic to 45%. And school and summer meals has increased from 27 to an astounding 63%, which is really great to see as well. We can go to the next slide. So this is a former WIC participant from Weymouth, and they say, we used WIC many years ago when we had young children and were both unemployed. It helped us get by until we got back on our feet. Go to the next slide. So from all this data, we created goals in our team and across to think about what can we do with this data to make programmatic and policy recommendations that we hope will continue to persist beyond this report. So the first goal was to really increase awareness and support for food assistance programs to continue to meet the high level of need we're seeing in the state. The second is to decrease inequities in food access. And the third is to improve experiences for those receiving services from hunger relief organizations. And with that, I'm going to turn it over to Jonathan Tatro, our Vice President of Community Impact.
Thank you so much, Dr. Fichtner. I'm going to walk us through on the next 2 slides, recommendations for anti-hunger efforts. And these recommendations, though the Greater Boston Food Bank has put this report together, these are not just internal recommendations for our operations, but these are really recommendations for all who operate in the food access, food equity space. Next. So this first recommendation is really about awareness. Awareness is so critical for both those individuals and families trying to access these services, but also for friends and family, colleagues to be aware of the services that their communities offer, because as the statistics showed, the prevalence of food insecurity is quite high. And so it is likely in any one of those settings that people are interacting with individuals and families that need these services. And so the more public awareness we have within each community, the more those services can be recommended by others in those people's lives. The second recommendation is really about convenient access. We can have all the services available in each and every community, but if those who need those services can't get to them and access them, they're really not serving the purpose that they're intended for. So exploring opportunities to make those services more convenient, especially food pantry services, is really critical, again, to closing that gap. The third recommendation is about centering the client experience in how these services are developed and delivered. We really need to focus on listening to the people that we're serving, hearing from them about what they need and how they need it to best optimize folks coming in and actually leveraging the services that are available to them. And then this last recommendation here is really about optimizing alternatives. We've seen some really fantastic and innovative ways of serving people who are experiencing food insecurity throughout this pandemic. The expansion of grocery carts, home delivery, curbside pickups, All of these non-traditional ways that have not been a robust part of the toolkit previously are excellent alternatives to the distribution methods that we have used for quite some time. And so looking through those innovative ideas so that we can improve access for those people who are seeking services is another recommendation. Next. So another recommendation here, again, really about connecting our distribution points to other services. This really gets to sort of a one-stop shop or a multi-service concept. And this allows those who are seeking these services to make the best use of their time that they're going to access these services. So if they can go to one place and get both food and then either referral or help in the application process for SNAP or WIC or other local support programming, that again is a best practice, and we really encourage the pairing of the services that are available locally. This next recommendation is about experience. We've seen in the data that stigma discrimination is a very real issue still for those who are seeking these services. And so we need to be informed and think about solution that addresses those at a structural point for those who are seeking these services, and include their voice and hear about their experience as we advocate for change. This next recommendation is about investing in historically underinvested communities. The data indicated Black, Latinx, LGBTQ+ individuals all have experienced food insecurity at higher rates. They also experience discrimination at higher rates, and so investing in the robustness of the services that are focused on those communities is an important piece of work that we all need to engage in. And then lastly, this is the recommendation is about data collection. And this report is one example of that. We need to collect equitable data and then use this data to actually make change, to use the data to improve the food access options that we have in every community, and the ability of our colleagues, our friends, our family, our neighbors to access those services that are so needed. And now I will pass it over to Catherine Lynn, who's going to go through some of the policy recommendations.
Thank you, Jonathan. Great segue into the policy recommendations. As Catherine D'Amato mentioned, we at the top of the program, we have an incredible opportunity before us to act on public policy right now. And one of the best ways to support all of our programming is through effective, sustainable, and systemic policy. I want to thank many colleagues across the state who actually did help us in consulting on these recommendations. And they were developed intentionally to somewhat broad to adapt and shift based on the constantly changing political landscape we're experiencing and anticipating over the next coming months to a year. First, I'll start with federal policy. So, I think we've got an incredible opportunity to support our federal administration policy changes and programmatic implementation. We also have an upcoming White House conference on hunger, health, and nutrition. Yesterday, there was the Northeast listening session, and there's several listening sessions and lots of activities leading up to the conference in September. And we have this incredible opportunity to have our voice heard and use this data for real change and making recommendations to be part of those conversations. There's two major vehicles at the federal level that also are before us that we have an opportunity to influence. So there's the 2023 Farm Bill and Child Nutrition Reauthorization that prioritizes, and we're asking, or recommending that we prioritize adequate funding, promote equitable access, and remove systemic barriers from federal nutrition programs, much like some of the waivers we've seen during the pandemic to reduce food insecurity and poverty. Policymakers should specifically support the continuation of elevated funding and increased access in the Farm Bill, specifically through TFAP and SNAP, and child nutrition through WIC, summer EBT, and universal school meals, and the implementation of the continuation of the child tax credit, which has been incredibly powerful and impactful on individuals and families who've experienced food insecurity during the pandemic. Here at the state level in Massachusetts, we're going to continue to prioritize policies that impact these vulnerable populations that we're seeing in this report that are impacted the most by food insecurity. Students, BIPOC populations, families, LGBTQ+ populations. And we have to do this while all sustaining increased funding through various programs that are going to support the emergency food system, this network across the state, MEFAP, also through SNAP and HIP, and then just the continuation of investing and working collaboratively across agencies, both nonprofit and government. I think ultimately we really want to, we know that food insecurity is a symptom of poverty. So we need, in order to really make an impact to these numbers, we're going to have to support policies designed to reduce poverty and the burden of unemployment and promote economic mobility. Adequate living wages will be key to ensuring equitable economic recovery. And I want to just make sure on the state level, I call out two very significant programs that we want to make sure are highlighted right now. Universal school meals is at a very critical juncture with the state budget. We're requesting and seeking a 1-year extension for school meals here in the state. And we know how critical and a lifeline this has been to families. And so this is a real focus right now in the coming weeks. And in addition, the Greater Boston Food Bank partners with the Food Bank of Western Mass on a statewide coalition on college hunger. And we have a bill that is before Senate and House Ways and Means, and we're looking for that to move forward right now. These numbers are staggering and the time to act is right now. So we have this incredible research, but it really does nothing if we don't put it into action. So thank you. Back to you, Lauren.
In sum, during 2021, our high levels of food insecurity persisted in Massachusetts, with inflation and the high cost of groceries being key drivers. Fortunately, a higher proportion of those experiencing food insecurity, we saw accessing food pantries, SNAP, school meals, and WIC. And increases in SNAP benefits, we heard loud and clear, was really helpful to Massachusetts adults experiencing food insecurity. But for many, obtaining sufficient healthy food still remains a challenge, and pantry users would like more convenient options, including grocery cards and home delivery. And as everyone mentioned, inequities remain incredibly prevalent, with Latinx, Black, and LGBTQ+ individuals and households continuing to disproportionately experience food insecurity and also higher levels of everyday discrimination. I'll pass it now to DJ.
Thanks, Lauren. Before I thank you all for coming, Kat, do we have any questions that we can respond to?
Yes, we do. So we're going to open it up for questions and answers right now. I just put in a message in the chat. So if you do have questions about any of the research that was just presented or the policy recommendations, please submit them in the chat, send them to marketing communications, or you can raise your hand using the Zoom feature. And I do have a couple of questions just to start that did come through. So first, I think that this question would be best answered by you, Dr. Fichtner. It's talking specifically about other sectors and how they can be engaging. It's not just the emergency food system, as we've noted, but specifically, how can the healthcare sector help with this in these recommendations?
Yeah, I think recognizing as a physician that you can't just identify hunger with your eyes, but to use the hunger vital signs developed by Children's Health Watch as best as we can and be screening for social determinants of health is really important. I think universal screening is important because we'll see on these surveys that their income in the past year was over $150,000, and yet they're screening positive for food insecurity on this survey and expressing concerns about where they're getting their money for utilities, et cetera. So I think as a healthcare community, we really need to screen, also let them know that many people are struggling with this, and get them to the services they need as much as possible. We also know the health outcomes of just accessing SNAP are really wonderful, same with WIC and same with school meals. And so I think pushing, accessing the resources that are available is important. I also was surprised when I started the food bank in 2019 that there's so much fresh produce distributed. So I think also mentioning that they're probably not going to get all canned items, they're going to get fresh produce, and it does excite people as well, because that's what they are looking for. And that came up on the survey as well, that they're looking for produce and healthy foods. Yeah, and I don't know, Kat, if you want to ask the next question. I see another one in the chat.
Yeah, thank you, Lauren. Well, we have Derek Silver from Senator Goby's office. Thank you for joining us. His question is, are there any regions of the state that have experienced an increase in insecurity compared to others? I'm wondering how more rural areas were impacted.
I think DJ can speak to this too, but what we saw was that there was, in the rural areas, those areas definitely had a higher increase in food insecurity as opposed to the urban areas. DJ, I don't know if you want to elaborate on that.
Sure. Yeah, that's actually something that we're still looking into a little bit more. We just want to make sure, since there's limited rural communities in the state, we just want to make sure we have enough data to support any estimates that we find. So it's definitely something that we're interested in looking into. I will say nationally, rural communities tend to experience much higher rates of food insecurity. So I would expect to see a similar trend within Massachusetts.
Thank you, DJ and Lauren. And Senator Goby, I know that since the district does have some rural regions, we can connect with Food Bank of Western Mass and also make sure we follow up with any detailed information. I have another question about grocery cards and delivery as methods of increased, I think I'm reading this right, increased access, and maybe Jonathan can speak to this question.
Happy to, Catherine. So the reason that grocery cards, home delivery, curbside pickups are really attractive alternatives are because they each in their own way address barriers to access. So for some individuals who are receiving grocery cards, they may have dietary restrictions or particular cultural preferences that are a barrier for them accessing the traditional foods available in a food pantry. So grocery cards address some of those barriers and allow them to go and choose their own foods. Home delivery addresses additional barriers. Those could be COVID-19 related if they're quarantining. Those could be mobility related if they have a physical disability and the local food pantry isn't handicap accessible. This could be transportation related if they do not have access to a reliable vehicle. There's just a whole host of things that home delivery addresses as barriers to accessing those services. Curbside pickup, again, this addresses certainly a lot of our COVID-19 concerns about transmission in the community, but also time. If you can submit an order ahead of time and have it prepared or pre-bagged so that you can just drive up and have it placed in your trunk, and you're leading a household with several small children and you're juggling school and childcare and a job, the ability to get to that food pantry and access those services based on that shorter time of service required, it greatly reduces that barrier. So each of these unique alternatives and creative methods help somebody in that community overcome a barrier that has likely been a challenge for them to overcome in the past. And so those are just a few examples of why those are really great to be able to pursue. And every community is different. Some communities have public transportation systems that are robust, some have none. And so again, the different interventions are going to need to be locally thought through. The people who are being served are going to need to be included in that discussion to identify what they actually need. And then you can try to address those barriers in a thoughtful way.
Thank you, Jonathan. I did receive a question privately, and I think that DJ can take this one definitely. These numbers are staggering, yet unsurprising. There's so many different data, food insecurity data out there. Can you explain how this relates to other data?
Sure. Yeah, I'll say, trying to measure food insecurity it's really challenging because it's not like taking somebody's temperature. There's a lot that goes into how somebody perceives their experience and what instrument is being used to measure food insecurity. But looking at other statistics available, like Project Bread, for example, produces estimates based on the Census Bureau's Household Pulse Survey, where they saw, I believe it was around 15% or so each month last year. So when you consider about 15% of the population every month experiencing food insecurity over the course of the year, translating that into about a third of the population, knowing that not everyone is struggling with food insecurity every month of the year. I find the estimates to be fairly relatable. As well, when you look at all estimates that I know of around food insecurity, looking at the inequities or disparities of Black and Latinx individuals disproportionately impacted, that's a common theme that you see throughout, unfortunately. So with this data, we're looking to address some of those inequities, but I would say our findings are similar to other estimates available.
Thank you, DJ. I don't see any additional questions in the chat. Want to just give it a minute in case there are any other questions. People want to raise their hands and ask a question. Actually, something just came in, sorry. Are there plans to survey intersectional identities in the future? Example, Black, trans people, etc. Also, any plans to survey religious identity or refugee status?
That's a great question. Yeah, that's definitely something that's on our list to do. When you're getting into specific communities like that, the best way is to work with organizations that target those communities. Doing a nationally representative sample, unfortunately, people with specific identities, it's hard to get enough information to accurately reflect the challenges that they face. So more focus groups and focused surveys of those communities is really what's needed to get at that data. So that's definitely something that we're interested in, working with other organizations that are pursuing that data. And if you are from an organization working with those communities and interested in exploring this further, we would love to hear from you.
Thanks, DJ. Oh, we've got a few questions coming out into the chat or comments. I will read a comment from Denise Arnold. One of our issues are that most of our clients walk to our pantry. Majority have small children or are elderly. I'm wondering if there are any specific grants or even the power of GBFB to help supply those grocery carts to pantries. That's a really great question. I mean, I think I know that the Greater Boston Food Bank does a number of community investment grants. We're going to be announcing our round this year's grants. I think it's over $500,000 in the next couple of weeks. I know that some of our other food banks also have given out capacity grants. So that's probably one way. But if you want to explore that further, I'm going to ask Jonathan to put contact information in the chat, and we can make sure we can address that specifically. The next question, from Lisa Ran, does the food bank plan to provide more grocery cards to agencies as a result of this survey? Really good question. And I'm going to put Jonathan again on the spot for that, that one.
Just unmuting myself as I'm typing the contact information in here. So the Greater Boston Food Bank has invested quite a bit in grocery cards in response to COVID-19, above and beyond what we've traditionally done. Traditionally, those were only part of our Thanksgiving operations, and we have changed that to be year-round and at a much higher budgetary commitment. So we are continuing grocery cards. We increased them quite a bit through COVID-19. So I don't think that we're taking this year's survey and report as an opportunity to increase that budget again, but it's confirming the efficacy of what we have done.
Thank you, Jonathan. Rep. Dom, actually, great suggestion. I hope this allows the hunger relief community to support the data equity bill's inclusion in the FY23 budget. I think that that's an awesome recommendation and suggestion, and that's why we're doing this presentation, so that we can unearth some of these other opportunities. And I would love to follow up with you offline about that one. The next comment or question is from Megan Witter. We have been trying to interview clients, guests about their experience at our food pantry. Is it always difficult to find people to chat with you? Can you send us some resources and information to help with us with this? I think short answer is yes. It's challenging for lots of different reasons, and I can turn it over to you, Jonathan, to speak to this. But I know that we're working on a number of resources.
Absolutely. So one of the things that we want to recognize as we use a client-centered approach to do all of our work, and even collecting stories, is that the people who we are serving, their time is valuable. And so including some type of incentive for their time that they're spending with you has been seen a great success and is considered a best practice when trying to collect information like that. So whether that's a grocery card or a cash option or something like that, compensating them for the time that they are giving to your operation it is an important consideration. The other piece of it, and we're not trauma-informed experts, but I would encourage all of you who are looking to collect stories and anecdotes and feedback on your programming to research trauma-informed practices, so that you are approaching people in a way that is safe for them, that you are not reopening past traumas or making them uncomfortable in how you go about asking for information. So you need to be cognizant of their time and ensure that the way you're asking, where you're asking, who you're asking in front of, all of those pieces are thought through to make sure that it is comfortable and safe for the people that you're speaking to.
Yeah, this topic is a big one, and I think we could probably talk about it for quite some time. I just want to read the next comment. Arthur Almeida says the clients increase a lot, even the food decrease, but we manage. Gift cards are gold that increase the clients too. Thank you for your support during that time, or this time. Thought time, I think it's this time. Thank you, Arthur, for your comments. I'm going to take this last question. Kristen Lundeen, can you talk more about GBFB and other local organizations help to address food insecurities among college students for those who aren't and are living on college campuses? Yes. So I will drop in the chat a link to our Mass Hunger-Free Campus Coalition website, which talks a lot more about these efforts. But I want to, and I know that Laura, Christina from the Food Bank of Western Mass are on, please feel free to jump in or drop in the chat any more information. But this coalition was established back in 2019, right before the pandemic. Thank you, Laura. And we are a group of hunger advocates, single point of contacts at college campuses, education advocates, poverty advocates, and we've gotten together and we worked with our bill sponsors, and Rep. Dom is one of those bill sponsors on that bill to bill, and on the Senate side, I should say, Rep. Vargas, Rep. Moschino are on the House side, and on the Senate side, Senator Chandler and Senator Lovely. And that bill is really a roadmap for college campuses on how to address college hunger on campus. And it gives you a whole variety of things, from awareness activities, engagement with students, and additionally, connecting with resources between, and thank you, Kathleen O'Neill is from our Bunker Hill Community College, also in the coalition. There's other, opportunities for school administrations to connect with financial aid offices, maximizing the utilization of SNAP and bringing EBT grocers onto campus. So there's a whole lot of information there that please take a look at the website. And the bill itself has a lot of those details, and the link that Kathleen pointed to is our Take Action page, and you can reach out to our Senate and House Ways and Means committees right now and tell them to move the bill out of committee and onto the floor for a vote. I think that might be a great way to conclude today on a policy action note. And we just thank you so much. And I'm going to just turn it over to DJ to close us out.
Thanks, Kat. And thank you all for joining us today. Thanks for your interest in this important work and for your partnership in addressing food insecurity. I'd also like to thank everyone involved in this year's study, including my fellow report authors and researchers, Dr. Rachel Zach, James Marriott, and Dr. Angela Odoms-Young. Additionally, I'd like to thank GBFB's Health and Research Council and our community and hunger relief partners that provided their unique perspectives and expertise to guide our efforts. And of course, the study's participants who graciously gave their time and provided invaluable feedback on their experiences with food insecurity and access. Lastly, I'd like to thank the Hunger to Health Collaboratory and the Stop and Shop Our Family Foundation for their generous financial support of this study. To learn more about the Hunger to Health Collaboratory and how you can get involved, please visit h2hcollaboratory.org. Thank you.